It's my understanding that the purpose is to reminisce about this very fine hospital. I came here in 1952, following graduation. At the time, I just finished medical school. I was broke, like many others, and I saw an advertisement that the provincial government was offering $5,000 annually to work for them. And I applied because $5,000 was an immense amount of money for someone who was broke. It would get me a new car and perhaps a grub stake to set up private practice. However, having applied, I found out that I was to go into a psychiatric hospital. My initials are JJ, John James. So I became known as JJ. I was most fortunate in being placed in St. Thomas. We not only had cattle, but we had turkeys. Lots of grain, 525 acres, and this giant building. To understand what's taken place here, perhaps you should consider it like a little village. At that time, mental illness was not the most popular condition in medicine, and it was hidden pretty well behind a woodlot. It's been built like a fort that's concrete, steel reinforced. So it'll be here for many years to come unless they discover some way of dismantling this giant. It was designed to accommodate 5,000 people. And the highest count we had, as I recall, was around 2,300. That's a lot of patients. The staff is the most important part of a hospital. And this staff was well-oriented to take the patients in and treat them as if it's their home. We tried to give them what many of them had never received in their lifetime, to be cared for, to be loved. Jimmy Wilson, who was the administrator, and he saw to it that they were extremely well fed, well clothed, well cared for from a point of view of hygiene and cleanliness and clothing, and entertainment and activities. And we had many, many programs so that it would cover all the patients, so that they would be able to experience all the activities that an ordinary citizen might meet in daily living in the community. That when I first came here and met Jimmy Wilson, he said, "Is there anything you want? Is there anything the patients might use or need?" And facetiously I said, "A swimming pool." And no hospital in Ontario had a swimming pool. Jimmy said, "You want a swimming pool? You got it." Annually, they would send sort of an actuarial around with a little black suitcase, and his purpose is to survey the entire building and all that's here and see that it's in place and doing what it's supposed to do. He was walking around the grounds, and there was nothing on his plans of this hospital indicating a pool. So he fell in. Well, geez, yes, bang, there he goes. Thank God we had a lifeguard on. We had John Coleman. He was our lifeguard. And so the fellow was rescued, and he had to report something that was just, it wasn't there.